Okay, so last week we talked about a common cause of low back pain, which was facetogenic low back pain, or back pain caused by the lumbar facet joints. Maybe I get those in view right there. Okay. This week I wanted to talk about a other common cause of low back pain, that's discogenic low back pain. So in your lumbar spine and your spine in general, you have multiple components. You have bones, muscles, tendons, ligaments. And you also have a unique structure called the intervertebral disc. In the lumbar spine, the intervertebral disc is located between the bones. It's conceptualized by this 3D projection as this little spongy thing. And it's kind of like the shock absorber of the lumbar spine. It's what absorbs a lot of the axial or axial loading energy transmitted by the body onto the lower part of the spine, so that as you are jumping up and down or moving, it's kind of getting squished a little bit and absorbing some of that energy. Now, what can happen is that because the intervertebral disc is composed of a cartilaginous substance as well as a lot of fluid, it has an annular structure on the outside called the annulus fibrosus, and a liquid structure or gelatinous structure on the inside called the nucleus pulposus. If it's repeatedly injured or repeatedly placed under strain, the nucleus pulposus, or the inner component of it, can actually extrude out and impact some of the nerves as they're exiting the lumbar spine right here through these things called neuroforaminal holes. Now, that can lead to what's commonly referred to as sciatica. What's more correctly referred to, though, is radiculopathy, or pain that radiates down a nerve root. So what typically happens is somebody will be exercising, lifting something heavy. They'll apply sort of more strain than is normal onto the lower back, cause one of these discs to protrude posteriorly or protrude back. That disc then contacts an exiting nerve root that's going down their leg and causes irritation, pain, and subsequently radiculopathy. That's why some people will say, I feel like I have a pinched nerve in my leg, or I feel like I have a pinched nerve in my back. That's usually caused by discogenic low back pain. The easiest way to diagnose it is by getting a lumbar MRI, which can identify exactly which level is affected. Most common levels are L4, L5. You have 5 vertebrae in your lumbar spine, and the disc between L4, the 4th lumbar vertebra, and L5, or the 5th lumbar vertebra, is the most commonly affected by this type of pain or this type of injury. Second most common is L5S1. The treatment for it is pretty direct. Usually people will do some rest, ice, they'll do some physical therapy, take some over-the-counter pain medications, and in about 60 to 80% of cases, that resolves by itself after just a few weeks. But oftentimes patients can't wait a few weeks, or the pain is persisting beyond that sort of conservative care period, and they want to do something a little bit more involved to get relief more quickly. They'd come to me and we do something called an epidural steroid injection. That's when we go down with the needle into the area on the back of where the disc is protruding and hitting the nerves, and we'd inject it with a combination of local anesthetic and anti-inflammatory medication to help reduce some of the inflammation and pain being caused by that disc. Relief from that is pretty quick. People tend to report relief within a few minutes to hours, and then they tend to experience long relief for several months. Again, this is a very easily done procedure. We do it in the clinic. Most people go home the exact same day and tend to report significant improvement in their symptoms, usually that evening or the following day. I'll usually have patients come in for a second injection in 2 to 3 weeks after the first, but if they're doing great after the first injection, we usually don't need to do the second injection. So again, another very common cause of low back pain, discogenic low back pain, something that's very easily treated and almost always does not require a trip to the emergency room. It's usually better suited to come to a pain clinic where it can be addressed right then and there, and avoid the need to be admitted to a hospital and go through the whole process of being in an emergency room.